Let's see. Okay, so I'm going to do another small review for nursing exams. Again, I'm not an instructor. I'm just a nursing student that is sharing PowerPoint presentations that I make while I study for my nursing exam. So this one is just on auditory, and it's a short little slide. It's a short little video, so. Auditory. So the ear has dual sense of function. It allows individuals to hear, but it also allows the sense organ for balance. But it is also the sense organ for balance. The ear is divided into 3 parts: the external ear, the middle ear, and the inner ear. I do suggest you do a little more thorough studying of what the external ear consists of, what the middle ear consists of, and what the inner ear consists of. But this is just a short review with a couple review questions. The sense organ that is responsible for hearing is the cochlea. The cochlea is filled with a fluid that moves in response to the vibrations, and that means the vibrations of sound. So the vestibular system is in the ear, and it is responsible for balance and maintaining equilibrium. There's loop-shaped canals in the inner ear that contain fluid and fine hair-like sensors that help you keep your balance. So when doing a hearing assessment, the nurses perform a basic hearing assessment during the conversation they're having with the patient. So when you're having a conversation with a patient, you can look for signs that the client's having a hard time hearing, like they'll lean forward, they'll be straining to listen to what the nurse is saying, or they might just not be making eye contact and just watching your lips and your mouth. They could also just be asking you to please repeat that. Can you repeat that? Okay, so nursing management of hearing loss depends on the patient's level of hearing loss. There's goals that you can set for hearing loss, and one goal is adjusting to the impairment, 2, verbalizing feeling about hearing loss, and 3, identifying a support system. So some of the review questions I chose here I wanted to talk about. So this first review question: the nurse needs to pull the portion of the ear that consists of movable cartilage and skin down and back when administering eardrops. This portion of the ear is called the A, auricle, B, concha? I'm not sure how to say that. C, outer meatus, or D, mastoid process. I'll give you a minute. The answer is A, the auricle. The external ear is called the auricle or pinna and consists of movable cartilage and skin. Now, so when you read this question, you can think back to this question when other questions are asked that may pertain to how you administer antibiotics, because tests are always trying to trick you. They may give you a question asking you the right or the correct way to administer antibiotics, and sometimes if you can think back to an easier question that you've studied regarding administering antibiotics, it may help you to figure out the answer to a question that might be just a little bit harder than this. So I just wanted to give you this one that's not that hard and explain how you can use this question to answer questions that may be a little more difficult. So another review question. The nurse is examining a client's ear and notices crumen in the external canal. Or cremen? I don't know. Which of these statements about cremen is correct? A, it's a sticky honey-colored cremen is a sign of an infection. B, The presence of cremin is indicative of poor hygiene. C. The purpose of cremin is to protect and lubricate the ear. Or D. Cremin is necessary for transmitting sound through the auditory canal. I'll give you a second. So the answer is C. The ear is lined with glands that secrete cremin, which is a yellow waxy material that lubricates and protects the ear. We all know it as earwax. What I do suggest for you to also do is to kind of try to figure out what's normal when you're examining the ear or assessing an ear and what is not normal when you're assessing an ear. So when you're assessing the ear, you should inspect the ear. There should not be any drainage from the ears because that indicates there's something wrong, maybe an ear infection. There shouldn't be any evidence of cremin impaction. That can affect your balance and your hearing. And the patient should demonstrate behavioral cues indicating effective hearing. Like if you ask them to do something and they do it correctly, then you know that they heard you. And then I'm going to just end with some assessment questions that you can ask pertaining to hearing. Have you had any trouble hearing? If so, do you wear hearing aids? Have you had any symptoms like ringing in the ears, drainage from the ears, or ear pain? Do you ever feel dizzy, off balance, or like the room is spinning? Have you ever been diagnosed with an ear condition such as an infection, tinnitus, or vertigo? And last, are you currently using any medications, eardrops, or supplements for your ear? When you ask these assessment questions, you might have to do a little bit of education as well because patients don't always understand words, medical words like tinnitus, which is ringing in the ear, or vertigo, which is dizziness. So keep that in mind as well when you ask any assessment questions that you may have to do a little patient education. Okay, thank you. Have a good day.